One of the products that has become quite popular of late is Ozempic. And Ozempic is an injection you get subcutaneously once a week for weight loss. So if you have, let's say, more than 20, 30% body fat, it's going to take you a long time to lose that weight. And so Ozempic is very effective at reducing your appetite. Now, there's some other, products. All of them are semaglutide, but you have Wegovy and you also have Rybelsus. So all of these products are very effective at reducing your appetite. They also cut your craving for alcohol. And of course, if you drink while you're on it, it can lead to nausea and vomiting, which is one of the more common side effects along with diarrhea. There are some pretty significant side effects that are associated with Ozempic, such as medullary thyroid cancer. Now, what's become more frequently talked about in regard to hair loss is Ozempic being associated with a significant amount of hair shedding and hair loss. So one of the things I noted many years ago was that my patients who had gastric banding or had a procedure on their stomach to reduce their gastric intake was very effective at reducing their weight, but it also caused a protein wasting and eventually significant and almost unrelenting hair loss. And it didn't necessarily seem to grow back. So, when you've had your stomach banded, your protein levels can drop quite dramatically. You have to really kind of force yourself to take in a lot of protein. So Ozempic, what it does is, and I've had some individuals I know, and they start out maybe at 20, 25% body fat or 30% body fat or more. And really, I don't think anybody under 30% should consider using it. But they start out with more significant levels of adipose, and they lose it, and they're pretty excited about that. So then they want to really push it. And it's usually when they push it into areas where they almost become, they almost look like they're, emaciated. They get too skinny. And that's when you start to really notice hair shedding. So I think you got to know when to come off of it. And then try to maintain your diet after that without having to go back on it. But as long as you're careful with it, you follow the manufacturer-directed protocol, and you don't push your weight loss too far on Ozempic alone, you should be okay. Now, I've had people I know, and we'll be out to lunch. I say, "What do you want? You want to get something to eat?" I'm gonna eat, and they say no, and I say, "Oh, I forgot you're on the Ozempic plan." So they just don't want to eat, and that can lead to hair loss. Now, what can we do about it? Well, first of all, we get you off the Ozempic. We can try things to help stimulate hair growth, like good quality PRP, minoxidil, topical. Probably we don't need to get into finasteride. We just need to stimulate anagen. So I would say the TED with TED serum would be good. Microneedling, the laser cap, and like I say, high quality PRP, which is very high platelet counts. Not just some PRP that a physician buys from an inexpensive source and doesn't even have an idea that what his platelet count is, which oftentimes or most of the time is too low to be effective in hair loss. So anything to stimulate anagen again, and also get rid of the offending agent, which all offending agents can cause telogen effluvium, like COVID, illnesses, a lot of stress. And so that's a little bit about Ozempic, and great product, but be careful with it in regard to your hair.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.